and Grace Mader, our Emergency Operations Center Operations Chief, filling in for our EOC Director, Jason Thorne, today. We've learned a lot these past 2 years about how to keep ourselves and our loved ones safe. Everything we are doing is to protect the residents and beat this virus. And it's vital that we all, including those who have already received the vaccine, continue to follow the public health guidelines to reduce the spread of COVID-19 and the variants in our community. And the best community service you can do for your family and friends and neighbors is to get vaccinated. Vaccination appointments are required for individuals who are eligible for third or booster doses, and information on that eligibility can be found at hamilton.ca/COVID vaccines. And if you haven't already done so, please talk to your trusted healthcare professional about getting your COVID-19 vaccine today, and booster shots, as well as vaccines for kids over 5 that is currently ongoing. So thank you for all your effort to make all of that happen. And that is our best way to defeat this virus going forward. I'm now going to pass it over to Grace Mader, who will tell us about any local changes for our municipality. Grace?
Thank you, Mr. Mayor, and good afternoon. I've got a brief update from our EOC. As we've shared in previous media briefings, the city began the gradual return to work process for senior members of our city staff last week. In light of the changing public health trends, we will be looking at the impact on that timing as we look at returning them to the office. We will be reviewing our plans and we'll be making an announcement to all of our staff later this week. With respect to enforcement, over the weekend, 74 charges were issued with 26 COVID-19 related, 17 charges under the Reopening Ontario Act, 16 provincial offenses notices for failure to comply, and 1 for obstructing any person from performing their duty. There were a total of 7 businesses charged and 1 private gathering. We had 3 noise bylaw charges along with 2 business licensing charges. There were 9 face covering charges with 8 charges for failing to wear the required face covering in an establishment and 1 for failing to post the mandatory face covering sign. There were 12 parks and 31 public nuisance penalties issued. All were related to violations around Tim Hortons Field during our recent Grey Cup festivities. Business charges are posted on the website along with any specific charges issued at www.hamilton.ca coronavirus FAQ about enforcement. And with that, I'm going to turn it over to Dr. Richardson for her update. Thanks.
Thanks so much, Grace. So I'm sure top of mind for everybody today is the situation with the Omicron variant of concern and what it means for all of us here in Hamilton. And of course, we are significantly concerned as we go forward. We are seeing here, as elsewhere, rapid transmission of the Omicron variant and it quickly transitioning to become the dominant strain. I know Dr. Moore has just spoken to a number of these items. So first I'm going to go through and address particularly our situation here in Hamilton and then underscore many of the things that you would have just heard this afternoon. For our local COVID-19 surveillance, we're sitting at 26,403 cases with a net change of 44 cases yesterday. Our activity continues to be highest in those between 0 and 59 years of age. Our 7-day moving average of cases is sitting at 53, and our weekly incidence of cases per 100,000 population is now sitting at 62, with our most recent updated weekly reproductive number sitting at 1.26. As you'll have seen from the Ontario Science Table and the information they are sharing, that our effective, as we call it, or reproductive number is even higher for Omicron itself. The average number of daily new hospitalizations is still low at this time. We are seeing less than 1 new hospital admission each day on average, and the average number of both ICU admissions and deaths does remain low. We are, though, expecting to see over the coming days what this Omicron variant does bring for us in terms of the severity of disease. And so our staff are working very hard with those across Ontario and around the world to understand what the disease is like with the Omicron variant and see what level of severity it has. And so very much over the next 2 weeks and going forward, we're looking to understand that further. The percent positivity here in Hamilton in terms of the tests that are being done is sitting at 2.7%. However, we are aware overall in Ontario that is now sitting at 6.6%. Our number of outbreaks has on average gone up. We're now sitting at 20 outbreaks that are active today, one new one today and one having been declared over. The details on all of those outbreaks can be found on our COVID-19 dashboard. There are three, though, that I do want to draw to your attention, and those are the ones where at least one linked case is being investigated as an Omicron case. Two of those are related to social gatherings, an event at the West End Pub and an event at Homewood Suites Hamilton Room. The third one is at a school at St. Patrick Catholic Elementary School, and we're going forward with getting verification of the Omicron cases under investigation through whole genome sequencing, which the Public Health Ontario Lab is doing, and our results are at this point pending. We do continue to follow up with anybody who's under investigation and their close contacts, and advising anyone who's contacted by Public Health Services staff, case managers, to follow their direction and guidance. The cases have been directed to self-isolate and monitor for symptoms until the whole genome sequencing results are in. We are treating all the cases related to these three outbreaks as if they are Omicron related until proven otherwise. On the vaccine front, Hamilton Healthcare Partners have now administered 931,000 COVID-19 vaccines, with an estimated 83.2% of Hamiltonians born in 2016 or earlier now having received a vaccine, and 78.7% being fully vaccinated with 2 doses. Over 27% of children 5 to 11 years of age have now received their first dose of vaccine. All right, so now I'm going to turn to talk to Omicron in particular. So of course, we are at an uncertain time in the pandemic with this new variant having emerged and spreading quickly, and us not getting the lead time that we've had, for example, with Delta, in understanding a little bit more from our partners around the world. Rather, we're learning this together. The projections from the Ontario Science Table do signal that there is something very different than what we've seen before, particularly when it relates to transmissibility. And so what we're seeing here in terms of the warning signs that are being put up is really a call for all of us here in Hamilton, all of us across Ontario, to listen to the messages that are coming out from the Science Table, from others and ourselves, around giving pause and thinking about how we move forward in this situation. There was some concerning data that Dr. Moore presented this afternoon. I've reviewed some of that already in terms of the positivity rates, and we've been seeing the increasing number of cases per 100,000 on average. Our experience around Omicron, a lot of it is coming from Kingston, where they now have a case rate of 280 cases per 100,000 per week. And they have been putting in increasingly more stringent control measures as a result. We're now hearing that the spread, even amongst fully vaccinated individuals, is infecting 4 to 8 times more individuals than the Delta variant did. And even if it is less severe, this could put significant strain on our healthcare system. It does seem to be that it is holding up, that the severity is less in vaccinated. So very much want to underscore, vaccination is still a very important part of this, this protection against Omicron. But we are hearing that transmission is unfortunately happening amongst those that are vaccinated. We are, of course, prepared to respond, but do anticipate that the road ahead is going to be quite challenging for all of us. The management of confirmed and suspected Omicron cases is enhanced, and has been now for a couple of weeks for all public health units in Ontario to further reduce transmission. We are experiencing, as several other health units are in Ontario, increasing pressure on our contact tracing, particularly around Omicron. And so confirmed cases and cases under investigation and their close contacts, it's very important that they follow additional public health measures, including isolation of all contacts, regardless of their vaccination status, and additional testing that is being done for contacts, along with frequent monitoring of confirmed cases and those under investigation. All of us have the ability, though, to continue to strengthen our community's response. The things that have worked and have gotten us here so far, that combination of vaccination and public health measures continue to be what is going to keep us in a best position when it comes to this Omicron variant. So get fully vaccinated. First and second doses are still important to get. And when eligible, get that third dose of vaccine as a booster dose. It does appear that this booster dose does particularly help to improve people's protection against the Omicron variant. The other thing is our public health measures. Those have stood us in good stead throughout and will continue to do so for Omicron. So those include wearing a well-fitting, properly positioned mask, maintaining physical distance, limiting the size of your social gatherings and the number of contacts that you have, and staying home and getting tested if you're not well. We need to remind people that any social gathering should be considered a higher risk, and you should think carefully about those risks and your own situation, the number of events you may attend, and these are particularly critical as you're thinking about attending family events and other events indoors. We are most concerned, as you heard from Dr. Moore just a few moments ago, about those at highest risk. These are those that are older, the immunosuppressed, people who've had transplants of any sort, and those on cancer therapy. As you will have heard from Dr. Moore, these people are being encouraged to avoid social gatherings altogether and to consider having medications and food delivered. For the rest of us, please look at your own situation and make a decision about how to move forward. In any case, we're suggesting you limit your number of contacts, but think about what the implications are for your personal health and for those and for your loved ones, particularly those who are living with you, in order to reduce the likelihood of becoming ill. For those who are now eligible for a third dose of COVID-19 vaccine, and for those who are going to be eligible over the coming weeks, please get that dose when you're able to. The healthcare system partners here in Hamilton, like those across Ontario, are ramping up to deliver more third doses over the coming weeks. You'll hear more about those plans in the coming days. Our primary care group, our hospital group, our colleagues across the city, I can tell you Grace has been working very hard to get additional people to support the efforts. We're coming together to try and ramp up to previous levels of vaccination as quickly as we can over these next couple of weeks. Residents will be able to access information, as always, about clinics on our webpage. As always, walk-ins will be allowed for those first and second doses amongst those who are outside the pediatric age group. Otherwise, appointments will, at this point, continue to be booked unless you hear from us otherwise. Our tool does continue to get updated with more appointments. At this stage, we're adding a few appointments, a couple of hundred appointments over the next day or so that will help to bring people in, and then we anticipate further increases afterwards. Additionally, we are also working with our school boards and recommending that our school boards implement some new measures, in essence going back to measures that they had been following prior to the decreased number of cases that we'd seen. And these are aimed again at reducing Omicron for the duration of this week. So this week, we are recommending cancellation of in-person staff meetings, social gatherings, holiday events, and for all elementary age students to stay in their respective cohorts at recess. We're looking at extending this to childcare settings as well. So again, strongly urging that everybody use the measures that have been effective so far. Get vaccinated, help your friends and family to become vaccinated around you. Follow those public health measures: masking, hand washing, physical distancing, limiting your contacts. It's going to mean a lot in terms of reducing the number of cases, but most importantly, reducing the number of cases that have severe outcomes like hospitalization, ICU use, and death, particularly amongst those that are most vulnerable over the age of 50. We want to save lives, and we want to protect our healthcare system so it can continue to serve us all. With that, back to you, Mr. Mayor.
Thank you, I think, Dr. Elizabeth. Particularly hard message to hear for this time of year, but it is the reality of what we're facing right now. So given what we are hearing about the spread of Omicron in Ontario and its transmissibility, we should all be considering our plans over the next few weeks with holidays and Christmas break very, very closely. And I know Hamiltonians are going to be thoughtful about the public health guidelines and recommendations that help us keep the numbers down. So that includes getting a third dose when you're eligible to do so. And we are already seeing some rapid spread. So we know the devastating impact it can have if we do not act swiftly. And I think we all intend to act swiftly to try and contain this. And every Hamiltonian plays a role in helping keep our community healthy and safe. So please do what you can, as based on Dr. Elizabeth's good advice, to get vaccinated, continue on with the masking, and limit your social interactions over the holidays. Not a great time to be doing this, but we don't control what the virus does, but we can control what we do. So with that, I'm going to hand it over to Jasmine for some questions from the media. Jasmine?
Great, thank you, Mr. Mayor. We have just 2 media joining us today. We'll start with 2 questions for each of you. First to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a good weekend and their week is off to a good start. My question is for Dr. Richardson. It sounds like a pretty dire situation at the moment. It sounds like it's only going to get worse. Why aren't we putting in public health measures right now, or tighter measures? Because it sounds like we're just relying on people to make the right choices. And while I'm not saying, I mean, I'm not an expert, but it just seems to me that, you know, we hear from people who are tired and fatigued. They feel like they've done their part. So can you explain why we're not hearing any new measures being put in place by Hamilton Public Health?
Thanks very much, Bobby. So a couple of things. There are some additional measures that are being put in place provincially around protecting the vulnerable in our long-term care homes and retirement homes. So there were some details released today in terms of increasing testing, visitor restrictions, really looking to protect those that are most vulnerable in those settings. As well, you're hearing the increasing vaccination campaign that we're all trying to get together so that we can get out, and particularly for those that are 50 and up, those that are immunocompromised, those who are at highest risk, and our healthcare workers looking to get vaccinations in arms as quickly as possible. That said, your comments about further control measures being needed, that is something that we're all looking at. You've seen my colleagues across the province, a number of those have put them in place. We are very much looking at putting those further in place here in Hamilton. We are consulting with the Office of the Chief MOH about those measures and what their plans are and when ours will come forward. So that's absolutely top of mind for us, and it's something we're actively looking at.
Thank you. And can you tell us more about, I was just a little unclear about which outbreak was potentially linked to an Omicron case. It sounded like you're treating every outbreak as if they are, but can you give us more information about the one that was potentially linked there?
Thanks, Bobby. I thought maybe it might be starting to sound like they all potentially were. So a couple of things. First of all, the 3 outbreaks that are being linked at this point to a suspect Omicron case, they are the event at the West End Pub, the event at Homewood Suites Hamilton Room, and a school outbreak at St. Patrick Catholic Elementary School. So those are the 3 outbreaks that have suspect Omicron cases. Then we're also looking at, as we go forward, a number of individual cases that are suspect Omicron, and so those are being managed as suspect Omicron cases as this continues to move forward. And in the next couple of days, it's likely we will begin to treat every case like an Omicron case, and I think we're just in the process of starting to make that transition.
Great, thank you. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the chance to ask questions. This one is for Dr. Richardson. Dr. Richardson, Ontario's Chief Medical Officer of Health was literally practically pleading with people today to get their booster shots. And we know it has been very difficult in Hamilton to get booster shot appointments. We've been hearing from, I can't even tell you how many people have contacted us saying they can't get an appointment. Dr. Kieran Moore promised today that capacity is being very significantly increased across the province. He said every public health unit is expected to significantly increase capacity. I don't really hear anything here that shows how Hamilton is going to significantly increase capacity. So what is the plan to significantly increase capacity for booster shots?
Thanks very much, Joanna. So we are happy to say about 47,000 booster shots have been given in Hamilton already. We have had that focus in long-term care homes, retirement homes as an early phase of this, and then opening up to the 70 plus. And we're doing very well in immunizing those who are 70 and over with booster shots. So that piece has been progressing well. As you know, on Monday, we did open up to 50 plus, and as tends to happen, we then have a surge of people looking to appointments. We're glad that we do have our own Virto system now for booking. And with the change that has occurred more rapidly, I think, than we were expecting with Omicron, you are seeing all of the healthcare system partners now pull out their stops to see what we can do over the next couple of weeks to get more of those third dose appointments onto the system so we can get people out. So that planning is very much actively underway, looking at what is the best way for that to happen, expansion of hours at our sites, other special clinics that we might open. We're very cognizant of the issues when it comes to those who have a harder time accessing vaccines, whether that's the homebound and looking to our paramedic partners to help to support that piece, our shelters and how the Shelter Health Network can support those sorts of settings. We're working with all of those partners to look at getting those number of vaccinations out as soon as we possibly can over the coming days. So you'll see more of that about that in the next few days as we're able to ramp those up and get those plans out for people to do. But remembering again, this is for those who are still 6 months out from their second dose. That's still the current recommendation. And for those 50 and over, and those who fall into those other high-risk groups, the immunosuppressed, those on who have certain conditions from that regard, as well as our healthcare workers. We are very much wanting our healthcare workers to come out, get those booster doses. We know how critical they are to keeping us all healthy, and so very much encouraging them to come out as well.
Thanks so much. My next question is also for you, Dr. Richardson. Christmas is less than 2 weeks away, and people have plans to get together with their families. Right now, the indoor gathering limit is 25 people. Like, what is your recommendation for people? Can families get together in groups of 25 still? Like, do people need to share Christmas plans?
Thanks very much, Joanna. That's very much under active discussion at this point. And so while we're considering where those recommendations or requirements may go locally, we'd very much encourage people to be looking at those plans. It's definitely not a message that any of us want to hear at this time of year. We would love to be getting together with our family and friends, but start now with thinking about your own personal situation, is what your personal situation is for your family in terms of their risk of severe outcomes from this virus, and start thinking about what adjustments may need to be made, and we'll come forward with any additional recommendations in the next few days.
Great, thank you, Dr. Richardson. We'll go back for 2 more questions each. We'll go back to Bobby first, if you'd like to go ahead.
Thank you very much. I appreciate that. Dr. Richardson, I also get a sense from people that I've spoken to that they're just not really sensing just how different Omicron is from Delta. Is there some sort of a metaphor? Is there just some way you can explain it or try to explain it to people? Because it seems like that's just not really connecting.
Thanks, Bobby. I think you make a really important point about people really coming to understand what Omicron means. And it's certainly been much faster in terms of the spread that we're seeing. And then for us to get the messaging out, understand it, and give people information that's clear for them to understand and to make good decisions with. So essentially what we're seeing with this, I think, as we've heard from Dr. Moore, you're seeing that 4 to 8 times more 4 to 8 more people are being infected with Omicron than was happening with Delta. And we are seeing that transmission from it is exponential right now in terms of how quickly it is spreading. And it's a very steep slope in terms of how quickly spread is occurring. So I'm not sure there's another analogy I can think of for you. I think it is going to take a little bit of time, and hopefully that time is ticking by quickly, as we've been hearing about this since last Friday when Dr. Moore was speaking to it, for people to fully understand. It's certainly not a time of the year when I think most of us want to be hearing about these changes we may need to make. But certainly it is something that people need to do. Mr. Mayor, you're very good at getting those points across. Anything you'd like to add?
No, but you know, just to reinforce the notion that that we are going to be doing a media briefing on Monday, and you know, we'll have more additional information. I think people need to be taking this one as seriously as all the other ones, and you know, this is not a cause for panic, but certainly a cause for action. And so we encourage everyone to listen carefully to the public health advice and take heed and make the appropriate changes over the holidays. And sadly, you know, I wish we could have not have had this happen at this moment in time, but the reality is the virus is dictating what we need to do, and that's hopefully going to lead to at least some positive attitudes towards it being Christmas, but might curtail some of the joy that we're going to experience through this holiday season that we might otherwise like to enjoy. So please, you know, this is an important issue, and you know, let's all take heed of these recommendations so that we can enjoy the future days into 2022.
Thank you. And my second question, or I guess my fourth, for Dr. Richardson. If I remember correctly, you mentioned in the past that once the % positivity number gets around 3%, it becomes really difficult for public health to contact trace every single case. I don't know what your human health resources are right now, but I just wonder, do you have a sense of when this variant may start to overwhelm public health's ability to accurately track it?
Thanks, Bob. And you've got a great memory. Yes, 3% was that sort of level that we talked about in the past. We have had boosts in resources and help from the province that has helped us with the contact tracing work that we do. I don't have a good sense of when that's going to happen, but that's certainly a concern that is going to happen. And we'll keep people posted as we go forward. Certainly, nonetheless, the control measures that we talk about, the vaccination, the public health measures, they are what's going to stand us in good stead and help both us not be overwhelmed, help our communities stay safe, and help our healthcare system be able to support all of us.
Thank you.
Thank you, Dr. Richardson. We'll go back to Joanna. Joanna, if you'd like 2 more questions, you can go ahead.
Thanks so much for the extra questions. Mine's for Dr. Richardson. Dr. Richardson, Dr. Kieran Moore, the Chief Medical Officer of Health, has said discussions are underway now for further provincial restrictions, looking at whether that's needed. What would you like to see brought forth provincially? And if it's not, will you bring it in for Hamilton specifically?
Thanks, Joanna. You know, when we're looking at these things, there's things that we've done before that have definitely worked. And so when we're looking at things like capacity restrictions, those have been things that have been important. When we've been looking at active screening, that has been important. When we're looking at masking in any indoor spaces, those have been very important. So all of those sorts of things are things that we would be encouraging people to look at, and we're looking at locally. So there's a list of specifics around those that would go forward, but we are just hammering out exactly what might be needed and continue to discuss that with the Office of the Chief MOH.
Thanks. And my next question is also for you, Dr. Richardson. You know, people are being asked to really limit their contacts, to really consider their gathering sizes, things like that. But I think it's really hard for people to take when they turn on their TV and still see full packed sports stadiums. I mean, Tim Hortons Field on Sunday had its largest crowd it has ever had. You know, first of all, are you worried about fallout from the Grey Cup, all the parties and all the people at the stadium? And second of all, is there anything that you would like to see Ontario do or that you plan to do here to stop these, you know, full packed events at stadiums?
Thanks, Joanna. You know, certainly we didn't expect to be in the situation we are in today. It's just been a week now since the last time I remember talking with Rick Zamperin and talking about where we were going with Grey Cup and hoping that people would definitely be, you know, following as much as possible, the masking, all those sorts of things. We certainly underscored that with the Ticats, and they were great in their response with us. But indeed, this is taking off very quickly and quicker than we would have expected. So yes, we are somewhat concerned about what might come of the gatherings that have happened over the last several weeks. Certainly what we're seeing are social events that are potential for Omicron, as you heard me talk about in terms of the events that we described just a few moments ago. And then looking at as we go forward, this is when we're talking about capacity limits and what might need to be put in place. These are the kinds of capacity limits that we're considering as we go forward. Certainly in relation to events, as you've discussed, but also one of the other things I didn't mention earlier was we know fitness as well. In terms of those sorts of venues also tend to be higher risk. So we are looking at it from both those angles.
Great, thank you, Dr. Richardson. Mr. Mayor, we'll wrap up our media questions there for today and pass things back to you.
All right, thank you very much. And thanks to the media partners for your questions and hopefully sharing that information with the broader community. And we thank Bill Custers and the entire team at Cable 14 and Clear Cable for their ongoing effort to put these media briefings together. And for more information on COVID-19, financial supports, and any updates, visit our website at hamilton.ca/coronavirus. I expect there'll be further announcements from the federal government, I imagine, in the days and the weeks to come in terms of supports. And to follow all the public health measures and get your vaccine. We can reiterate again. So please do talk to your healthcare professionals and get the best advice. And if you haven't had your first or second dose, clearly do that. And for those that are eligible for the booster dose, you can book now and get that dose as soon as possible. Find the latest information on the city's website at www.hamilton.ca/coronavirus or by following us on social media. So that's all for today. We will see you back here on this coming Monday, December the 20th, for an additional COVID-19 briefing and an update as to what the impacts might be locally and in the community. So thank you for tuning in, and we will see you next time.